Hi, my name is Marcy, and I'm a registered nurse with the Edmonton Southside Primary Care Network. Today, I will be talking about medications and how they affect or can affect your memory. We are looking at page 12, and this page is questions to ask your doctor or your pharmacist whenever you get prescribed a new medication, or you can even do it for the medications that you're on to understand them more. Now, I know different pharmacies do different things. I've seen some pretty amazing things that they've done to make it more clear as to what the medications are and what they're for. So work with your team. They're pretty good at helping you be able to take your medications on your own as effectively, as safely as you can. And if that's not possible, there are programs out there like home care that will specifically come into your home and help you take medication if that's a need that you no longer can do on your own or do not have people in your life to help you with that. There are also lots of devices out there, dosettes, blister packing, different kinds of pill bottles, pill containers, some that are battery operated and remind you at specific times of when to take them. Some are just labeled by the day. Some break down the days into different times. It all depends on your needs and how many medications you're on. But the most important thing to remember is that the more medication you're on, the more chances you have of actually having an issue with your memory because of interactions. And that's why it's so important that you work with one pharmacy with your medications, because if you go to different pharmacies for different medications, there could be some confusion if your pharmacist doesn't know of all the medication that you're taking. So the questions on page 12 are very self-explanatory. We'll just go through them here. And these are things that you can discuss with your medical team. Question 1 is, what is the name of the medicine? And there are different names. There's a generic name and there's a brand name. Now, for example, I've known of people that I will ask them if they're on a certain medication, and they'll say, oh no, I'm on this medication. In actuality, it's the same medication, but because it's different names, they're unaware of that. Second question is, what will the medicine do to help me? So you want to know what it's for. Question 3, why do I need the medicine? Number 4, are there any other medicine or treatment options? If you're a person who does not like taking medications unless absolutely necessary, this is an important question because you want to know your options if there's other things that you can do to get the same effect. Number 5, is the medicine covered by my provincial health plan? That also falls into play for number 4 because sometimes there are medications that do the same thing but maybe are less expensive, and these come into play especially if you don't have comprehensive health plans that cover all of your medications that you need to be on. Number 6, can I start by taking the medicine for a few days to see if it agrees with me? If the medication is something that the doctor is concerned about, sometimes they will start on lower doses and increase it until the desired amount is hit to see if you do have side effects. And so some medications have a lot more side effects than others. And so sometimes the doctors will know this ahead of time and will say, okay, it's important that we start slow. Number 7 is, how do I take the medicine? Sometimes there's special instructions. Sometimes you have to be aware if they're allowed to be in the sunlight, if they need to be refrigerated. Sometimes you have to take it with food or without food. Number 8, what amount do I take each time? The dose. And this is important. Again, I just had a patient come to me telling me they were on a certain dosage of a certain medication, and it was just them reading the pill bottle incorrectly. The pills were in certain dosages, and they were supposed to take uh, more than one pill, but they thought their dosage was just that pill. And so you have to be aware, because sometimes the pharmacist can't give you the full dose in one pill. You might have to take 1.5 or 2. How often should I take the medicine and when? Some medications have to be taken at certain times of the day, and there are very specific instructions. Some have to be taken first thing when you wake up with nothing in your stomach, and you have to stay seated in an upright position for half an hour before you're able to lie back down or take any sort of food or drink. What are the common side effects of the medicine? That's good to know. What do I do if I miss a dose of the medicine? Sometimes you will be directed to take the medicine, even if it's later, depending on how late. If you notice, a short time before the next dose is due, then most times you may be told not to take it. But again, you want to clarify. You don't want to be doubling up or taking a medication that you shouldn't be. Sometimes you just miss the dose if you miss the dose. 13, how long will I need to take this medication? Is it a lifetime medication? Is it until a certain thing is achieved? It could be an antibiotic, which is very timed. It could be just for a few days. It could be until you have a surgery. So it's very important to know how long you'll be on the medication. How will I know the medicine is helping? Many different ways of knowing this. It could be in a lab value. It could be in the way that you feel. Again, good communication with your health team is important. And what is the next step if the medicine doesn't work? Again, talking to your medical team. And sometimes you'll plan this ahead if the medicine doesn't work. Sometimes you'll wait, give it a chance, and then discuss other options if it doesn't. Sometimes people are very sensitive to medication, so dosagings have to be changed. Again, sometimes the body just can't tolerate, depending on what the medication is working on. If it's a medication that affects your heart and you're having heart issues, then that may have to be a totally different drug or something else to help you. We do not want to make anything worse. And you'll hear people say all the time, I'm taking this medication for this side effect from this medication for my medical condition. So sometimes it can get very complex. And then some quick tips for your medications and taking it. And this is very individual, and we're just going to mention a few things that people do. But it's however you remember is what's the important takeaway from today. Planning a daily schedule, so knowing how and when to take them, and you want your schedule somewhere where you can see it and will remember it. Some people do use the pill boxes, the bubble packing. I've been seeing patients who will use very unique ways of remembering their pills. Sometimes they'll have post-it notes in areas that they'll remember, like by a clock or by their bathroom mirror, and reminders of when and what pills. And it's important that you know what that big white pill is for. And just in case, you do mix up your pills, and if you don't know what they're for, you might not remember if you've taken them and how important they are to take or not to take. If you pair it with something like brushing your teeth, so if you take your morning pill when you get up, whatever you do first thing in the morning, to just pair it and it becomes more of a habit, more of a routine, that's a good way to remember. Um, Pharmacies are becoming much more proactive. So sometimes, just the other day, I actually got a phone call from my pharmacist saying, well, according to our records, this medication should be empty. Would you like us to renew it? So again, if your pharmacy doesn't do that, sometimes just knowing how long the medication will last you, and then making a note somewhere of when to reorder. A lot of people will reorder their meds on a monthly basis, and especially if you get a blister pack, sometimes you only get a certain amount at a time. So it's kind of part of their routine of getting a new refilled prescription to come to you. That's it for today about medications. Medications are very important to be taking properly, to know what you're taking and why you're taking and when you're taking. It's important to understand your medication. And if you don't, that's very important to reach out and to get help with doing that so that you are safe in taking your medications.